We're starting recording. So welcome everybody. This is our Quality Reviews webcast series. I'm Ed Shin. I'm the CEO, co-founder of Quality Reviews. And for those of us who don't know us, we help health systems and healthcare provider organizations improve experience through real-time feedback. And we've got other patient engagement tools. But it is my pleasure today to welcome back Dr. Sachin Jain. Dr. Jain is the CEO of Scan Health Plan in Southern California. We talked to Sachin over a year ago now, so this is, I'm eager to follow up with you, Sachin. Welcome. It's really great to have you back.
Great to be here. Thanks for having me.
So the title of this webcast is, Social Determinants of Health, and I threw in some other things there. So I really want to keep this organic, but let's start there. You've talked a lot about SDOH, Social Determinants of Health. And, I've read some articles that you've written and viewed some other interviews that you've done. And this is an interesting term, and in many respects, a misnomer. So go into that, because I like the controversy element of this. And why do you think SDOH is a misnomer? And why do you think it's actually holding us back from its stated goal of reducing healthcare disparities?
So I've been a part of a lot of organizations that have claimed to have social determinants of health strategies. And I think I've seen over the last 5 or 10 years a proliferation of social determinants of health initiatives, benefits at health plans. And at the end of the day, I think what we're doing is we're painting big societal problems with the brush of SDOH. And when we name it and then we introduce some kind of token initiatives to solve SDOH issues, it creates this false sense of security and accomplishment that we've actually done something to address what are, I think, fundamentally far deeper issues that are plaguing our society. And I think of the term code a lot, because I think we have a lot of codes in society. And SDOH is really just code for poverty and racism. And we make ourselves feel better. We say, oh, we're introducing a medical rides program for poor people, and therefore we've solved their healthcare access problems. Or we've implemented a post-discharge meal program for people who are hospitalized to ensure that they have meals waiting for them when they get home. But then we don't really address the fact that they were hungry for the 30 days leading into that hospitalization. And so, and again, I think that there's a lot of self-celebration in our industry of what I think of as mediocre or marginal interventions that don't actually make a huge difference. I was part of a Robert Wood Johnson Foundation panel kind of evaluating the evidence for interventions to address what is now being called drivers of health, which is another kind of term for social determinants of health. And the truth is that there's very little data that suggests that any of the interventions that we celebrate actually make a difference. And so again, I look at this kind of now, to moderate my opinion a little bit, because I know we're in the realm of controversy here. Do I think it actually makes a difference for individuals, in particular situations? Is it good to give a hungry person a meal? Absolutely. Is it good to give somebody who doesn't have a ride? Absolutely. I'm not saying that. But when you look at these interventions spread over large populations, there's not a huge effect size. And so, again, I think we have an opportunity to do a lot better. And I think we should, have some authenticity as it relates to how we actually assess what we're doing and the difference that we're actually making.
Got it. That makes a lot of sense. For those of us who are listening, primarily a healthcare audience, everybody I'm sure is nodding their heads, as am I, but to push back a little bit, just to continue the controversy, I'll say, Dr. Jain, I'm just a doctor or I'm just a nurse. I can't solve society's problems. I mean, I wish I could get rid of poverty and make, societal changes, but I'm just one nurse, I'm just one chief medical officer, or I'm just a social worker working in a hospital. What can we do really to address this really baseline systemic problem of poverty and discrimination? Because, I've got my day job, right? Being a nurse or a doctor. So talk to us a little bit about, from a vantage point of being within healthcare, how to then address some of these systemic issues that you're referring to.
I think how we define problems ultimately influences how we solve problems. And the reason I'm arguing for this broader